So good morning, everybody. Lots of very interested people when it comes to health, I think. I'll try to give you first a lay of the land, and then where potentially there are challenges and opportunities for all of us to help participate in what is probably the most exciting time in terms of healthcare in the country. First, a little bit about PHAP, my organization. We do represent mostly 42 research-based innovator companies. Our products are not the generic. We make new stuff. And some of this new stuff you will hear from Dr. Kwek later on as he talks about oncology, a very exciting dynamic area today. We are members of 2 international organizations advancing pharmaceutical research and global health throughout the world. This is our vision and mission. And again, we want to really advance access to innovative new medicines that can really change the life of people. Now, our advocacies include universal healthcare. What's a multinational company worrying about universal healthcare for, right? That's a public health issue. No, it's not. It's a nationwide issue that affects every single one of us, and I think we should pay attention to this. We want to make sure there's access to all of the new stuff that's coming through the pipeline. We want to do this in an ethical manner, which is why we actually got the Department of Health to actually issue guidelines on how we actually do business. Can you imagine that? A self-regulatory agency, self-regulating group asking the DOH to regulate us. Go figure. And then, of course, corporate social responsibilities. This is a bit of an infographic that was published in 2015, but it's still pretty relevant. For every dollar we bring into the country, we actually generate at least $3 in internal economy. Hotels, cars, employment, etc. So really, we are a significant player in the Philippine economy. And of course, we give back. Since 2003, we've donated more than 800 million pesos. In the spate of the recent disasters from 2015 onwards, it's probably crossed a billion pesos worth of free donations already coming from our company's membership to the affected communities. And it's not just during times of disaster. We actually have what we call universal healthcare communities, where we actively help them to see if they can help achieve universal healthcare for themselves. So, that's a background of who we are. Let's talk about the state of the nation's health affairs. I may not be the member of the Department of Health, but we're very, very interested in what's going on. And to be honest, we have a lot of issues. First and foremost, our healthcare is a highly fragmented and devolved system. That may be good, particularly if you have dynamic, innovative leaders of the municipal governments. Everything emanates from the mayor. And there are many really good examples of that. But every 3 years, you go through this cycle. And we're about to enter one cycle in 2019. And the Philippines is in a pretty unique situation where we now have a triple burden of disease. What does that mean? We are not anymore just a third world country dealing with infectious diseases. And if you look on the left-hand side, those boxes below, the light doesn't show here, everything in orange are infectious diseases. And you can imagine, we still have quite a number of infectious diseases that occupy a lot of the health concerns and disabilities that our countrymen face. Number one alone would be, of all things, infectious diarrhea. And then at the same time, we have the Western lifestyle diseases of cardiovascular diseases, hypertension, heart disease, stroke, and of course, cancer. Yet at the same time, our resources are spread all over the place. Not really spread all over the place, highly concentrated in urban centers. So we have this inequity of how our people can actually access healthcare. At the same time, kulang pa rin yung infrastructure natin. Not enough beds, not enough nurses, not enough hospitals in the right place. So it looks kind of sad. But at the same time, if you look at the Philippine medical institutions or the landscape, it is one of the most highly regulated in the world. I've had external consultants come in, take a look at what my organization is doing in terms of external affairs, and probably said, whoa, you got a lot on your plate because of all the legislation that's going on. But arguably, before 2018, probably the most exciting piece of legislation that passed was in 2012, bottom right, where we finally passed the sin taxes, what's now commonly called the sin taxes. And basically, ladies and gentlemen, sin taxes are now paying for your health care. So to all the smokers in the room, keep going, you're paying for my health care. 30 pesos a pack of cigarettes. But that's not enough. Think if that had gone up to 90 pesos a pack. You can imagine what would the Department of Health's budget be. That would be fantastic if we can finally get the next piece of legislation through. So yes, the Philippine Department of Health budget has more than doubled, practically doubled, these last 3-4 years, ever since the sin taxes kept rolling in. And so, which is why it's very, very exciting, because it actually pays for a lot of the new programs of the Department of Health, including national immunization programs versus pneumonia, tetanus, human papillomavirus, etc. All of these things, increasing coverage from PhilHealth. They now claim universal coverage, 92%. But what are they covering? A lot of us still scratch our heads when it comes to that. And then there's definitely at the same time a rise in total health expenditures. Despite all of this background, there's still a lot of that's being left behind. Many, many realities still bite us every time we get out there. High infant mortality rates, particularly among the poor. Maternal mortality. Too many women having too many children. And they actually subject themselves to all sorts of risks. Can you imagine giving birth to life and yet you're dying? That's an unacceptable situation. And then, the fact that out-of-pocket is really still the way the Filipinos access healthcare. And with the inequitable distribution of health workers and government facilities, we still have a long, long way to go. And that shows in the other parameters where we lag behind that of our ASEAN neighbors. Philippines is always in the bottom half of every parameter that you look at. Particularly when it comes to tuberculosis, we're still the #1 country in the world for TB. Can you imagine that? #1 country still in terms of tuberculosis. So we still have a lot to go, but that should not restrain our ambitions. I heard kanina our prayer that we want to be a first world country. Okay, so let's go for the Sustainable Development Goals. Let's be ambitious. Big, hairy, audacious goals. And we've heard that term before. All right? And number 3 there, in those big sustainable goals, includes vaccination. Vaccinate every person with the vaccine to prevent these vaccine-preventable diseases. Yet what's happening? Vaccine or confidence in vaccines has plummeted big time, down to 32%. Acceptance rates of the NIPs or the National Immunization Programs of the Department of Health has plummeted to below 60%, one of the lowest ever. And when you have acceptance rate of only 60%, guess what, guys? Pandemic is coming around the corner. It's just knocking at the door. And already we're hearing outbreaks of measles, we're hearing outbreaks of diphtheria, whooping cough. Hello? And it's not just in some remote province, say in Samar, it's in southern Metro Manila. It's literally at our doorstep. So, that's the bad stuff. What's the good stuff? Well, definitely universal healthcare is something that's really, this momentum is something we can no longer stop, that nobody wants to stop. In fact, what it's all about really is how we, as organizations, can now partner with the Department of Health to actually further universal healthcare. And how do we do that? Oops, let's go back. Back in 2010, before 2010, there was this universal healthcare study group in the University of the Philippines, talking about, under the leadership of the late Dr. Kwasi Romualdez, how can we actually ensure that every Filipino gets healthcare? And a study that we commissioned with the social weather station found exactly that. That's what exactly Filipinos wanted. The vast majority of our nation wanted that medical healthcare rights be treated as a human right under the Constitution, that the government should provide, be they rich or poor, and particularly for those who cannot afford it. what's the main fear anyway when it comes to healthcare? Catastrophic health illness, which will probably lead all of us to bankruptcy, destroying the future of the family left behind. That's the main fear when it comes to health. Yet what we have is a situation on the scene on the right-hand side of the graphic where 85% of access of healthcare is by out-of-pocket, meaning you're paying it for yourself out of your salary. That's not universal healthcare, is it? So, it's important to think about this because universal healthcare is not just about financial stability or protection. It's also about the kind of products that are made available for the nation. And yes, medical products and technologies will always be part and parcel. And let's disabuse anybody in this room if they have any misconceived notions. But yes, generics dominate the market. There are important roles for innovative companies such as ours, critical roles for generic companies. And today, in both peso value and in terms of counting units, actual tablets sold, generics dominate. Everything in orange up, that's the generic. So be it in value, halaga ng generic, di ba? Right? Compared to innovator, less than 50%, dapat. They still dominate the value. So yes, generics dominate the market today, which is the rightful place of generics. So universal healthcare actually made it, the bill in the Senate, made it to the third reading. So it's now in the reconciliation phase between the lower house and the upper house. So hopefully, before the end of the year, we'll actually have a law passed that will now mandate that every Filipino gets covered for at least primary care services, some hospital-based services, with no balance billing, meaning the patient can come into the hospital if necessary, and if you have absolutely no money left to pay, the government will pick up the bill. You don't pay a single centavo when you step out of that hospital alive. Alive, hindi dead. I don't know about the dead part. So that's what universal healthcare will hope to achieve. Not only will Filipinos be now able to access all hospitals where they need when they need it, but also primary care services, which is probably even more important than hospital services. And running alongside the universal healthcare bill is the National Integrated Cancer Control Bill, where this time cancers, probably the most dreaded illness for all of us in this room, will also be covered. There will be funding sources to help improve diagnosis, improve testing, improve treatment, and actually even palliative care and effective survivorship care and rehabilitation. So it's really exciting what's going on now in Congress. So I urge everybody to pay attention to this, particularly this last 2 months of the year. For all we know, by December, all of these bills will be signed. And if you have the notice, there was the first 1,000 days bill, first 1,000 days of life of a child, that had already been passed. The extension of maternity leave to 105 days. So there's a lot going on in this healthcare space. And that's important. But it's also important to make sure that the innovative stuff comes through. Just this year, guess who got awarded the Nobel Prize for medicine? The people who discovered the concept of targeted therapy. Harnessing the body's immune system to attack cancer. Already this type of therapy is not tomorrow, it's today. It's already available throughout Asia. China has just had a big launch. Philippines has also been available. It's available in Hong Kong, Singapore, and the rest of Asia Pacific. We're not far behind that at the West. So these are areas where there is a huge contribution from the private sector. And it's not just about generics, it's also about innovation. And also about access. How can the Filipino patient get these products when they need it? So that talks to financing. It talks to patient access programs. It talks to just making the product available in your country sometimes. How can we leverage to make it actually cheaper? To multi-year contracts. It's one way to do it. Pooled procurement so that by the volume you can actually drop the price. So this is where really a lot of us in our industry are focusing on. how can we help universal healthcare succeed? We need to take care of the primary care. We need to make sure that the Filipino has access to health. So which is why really it's a whole society commitment. And PHAP does commit to continue partnerships to actually help achieve universal healthcare. And that means talking to patient groups and communities. That means working closely with government if and when they finally agree to sit down and listen to us or work with us. It's also talking to healthcare professionals. How can we help improve their knowledge of all of these new therapies? And of course, all the NGOs that have stakes in different pieces and parts of the healthcare, particularly reproductive health, particularly those who want to try to raise again vaccine confidence. So this is what PHAP is all about. This is what we do as an organization. And at the same time, we're really very excited in today's particular landscape as to where healthcare is going and how we can be part and parcel of this journey. So thank you everybody for your time, and I hope this opened up your eyes a little bit what's going on now. Thank you.